You're a prehistoric human. You don't have hospitals, you don't have bandages, and you don't have any form of medicine. What you do have is fire, rocks, bacteria, and wild animals trying to nibble at your loincloth. Here's how early humans managed to survive everyday injuries. Number 1. Broken bones. It's early morning. You're gathering berries like usual when all of a sudden you slip on an inconspicuous banana peel and fall off a cliff. Your leg bends in a direction in which legs shouldn't normally bend, and you end up with a broken tibia. What do your fellow ancient humans do? Surprisingly, they handle it pretty well. Archaeologists have found skeletons from more than 50,000 years ago with perfectly aligned fractures, clean healing, and signs of long-term survival, meaning someone must have set the bone, immobilized it, fed the injured person, and protected them for months. Was it as effective as putting it in a cast and watching YouTube shorts until it heals? No, but it's surprising it worked as well as it did, given that their tools were mainly comprised of sticks, mud, and animal tendons. This is the earliest version of a splint, and it somehow worked. Number 2. Burns. Fire was the ancient human's best friend, and also one of his most common cause of injury. Imagine you're sitting around a fire with your fellow prehistoric humans. You're roasting a questionable hunk of mammoth meat someone offered you, much like an ancient marshmallow, when all of a sudden your makeshift skewer snaps and you drop it in the flames. Your first instinct is to reach for it, and boom, you get served with a generous handful of blisters. For the following days, your treatment would include wet clay to cool the skin. Don't ask where it came from. Ash, from the very same fire you dropped your mammoth marshmallow in. To dry the wound, and animal fat to seal it. Which is really similar to how we deal with burns today, though much less sterile. It wasn't necessarily pretty, but it kept infections away long enough for your skin to heal, and that's more than anyone could ask for back then. Number 3. Animal bites. Bites could occur for any number of reasons. The main 3 would be wolves, hyenas, or bad decisions. If one day you decide to poke your stick into the wrong den, you might suddenly find yourself becoming the proud new owner of a very painful, possibly life-ending bite, and though it looks cool, it is dangerous. So let's fix that. Step number 1. Wash the wound in cold water. Step number 2. Suck out the blood. Step number 3. Cauterize it with fire. Step number 4. Pray that prehistoric rabies isn't a thing. Congratulations, you get to live another day. Now time to go get revenge on that wolf. Oh no. Number 4. Toothaches. You're relaxing after a long day of not being eaten, enjoying a nice, crunchy handful of unwashed nuts. You bite down, hear a sickening crack. Congrats, you've got a broken molar. Keep in mind there are no dentists, no numbing gels, and definitely no tooth fairy coming to leave a shiny pebble under your pile of leaves. So, what's the move? Well, your options are limited, and they all hurt. Option A. You chew on some willow bark, which contains a natural chemical similar to aspirin, and just hope the pain goes away before you lose your Neanderthalian mind. Option B. Get the caveman extraction. Your buddy grabs a sharp piece of flint, a heavy rock, and tells you, or grunts at you, to bite down on a stick. Now, he's neither gentle nor professional, but he does manage to pop out your cracked pearl, making you one of the first prehistoric humans to survive a cracked tooth only to die of an infection 2 weeks later. Number 5. Deep cuts. You're out hunting, trying to look tough in front of the local gatherers, when you misjudge the swing of your stone axe and slice a deep, gushing hole right into your leg. Blood is everywhere, and your favorite loincloth is ruined. And with no access to stitches or bandages, you need to seal the leak. Fast. Step number 1. Slap some spiderwebs on it. Prehistoric humans figured out that cobwebs act like a natural mesh that traps blood cells and helps the wound clot. Step number 2. Pack it with moss or mud to stop the bleeding. And don't worry about the dirt. You've got bigger problems right now, like your reputation being ruined with the gatherers. Step number 3. Tie it tight with a strip of animal hide or a tough vine. Hey, you're looking better already. Now, go wipe off the blood and act like it didn't hurt. Number 6. Parasites. Let's be honest, your daily diet consists of unwashed roots, murky river water, and animal carcasses that have been sitting out in the sun for days. It's not a matter of if you get a prehistoric stomach parasite, it's a matter of when. One day, your gut starts doing violent backflips, and suddenly you're spending all your time sprinting behind a bush instead of hunting. You've got a belly full of uninvited visitors. What do? Visit the local shaman and get the world's first stomach pump. Your treatment involves eating charcoal straight from the campfire, or clay straight from the river. Apparently, charcoal and certain clays naturally bind to toxins and bacteria in your digestive tract, neutralizing the bad stuff and flushing it out of your system. After a few days of a very dusty diet, you're good to go, clean, cured, and ready to eat some more questionable meat. Number 7. infections. You've survived the bite, the deep cut, and the broken bone. Great job. But a few days later, you notice your wounds are turning an angry shade of purple. They feel hot enough to cook an egg on and smell like a dead hyena. Welcome to the prehistoric infection. To stop you from turning into a fossil ahead of schedule, your tribe has to get creative. Their secret weapon is comprised of mold and maggots. If the wound is oozing, they might slap some moldy bread or fungus on it, completely unaware that they're actually using a primitive form of penicillin. If things are really rotting, they might introduce some friendly local maggots into the wound. Maggots only eat dead, infected tissue, leaving the healthy flesh perfectly clean. It's disgusting and it tickles in the worst way possible, but it keeps the rot from spreading. You're all patched up now, but I wonder what could be next. Number 8. Frostbite. It's the middle of the Ice Age. You stayed out late chasing a woolly rhino during an unexpected blizzard, and by the time you stumble back to the cave, your fingers and toes look like frozen blueberries, and you can't stop shivering. Without central heating, thermal blankets, or hot cocoa, you are dangerously close to becoming a permanent human popsicle. So, what's there to do? First, your tribe shoves you into the deepest, darkest corner of the cave away from the wind and piles heavy, sweaty mammoth pelts on top of you. Next comes the ultimate prehistoric survival tool. Awkward, aggressive, non-negotiable human-to-human body heat. Your fellow cavemen pack themselves tightly around you like a litter of giant puppies to get your core temperature back up. But what if your toes are already black, dead, and rotting from severe frostbite? Well, there's no saving them. To stop the rot from traveling up your leg, your buddy grabs a sharp flint stone, tells you to look away, and chops them right off. It's a brutal way to lose a pedicure, but hey, losing a few toes beats losing your life. Number 9. Head trauma. You're out apartment hunting for a new cave, when a falling rock tries to get to know you a little better and falls directly onto your head. Your skull is dented, your brain is swelling, and you're about to die. Without modern hospitals or CT scans, you might think you're doomed. But, surprisingly no. Your caveman buddies actually had a fix for this. DIY brain surgery. Archaeologists have found hundreds of ancient skulls with neat, circular holes bored into them. The bone actually showed signs of healing, meaning the patient survived. To save your life from the swelling, someone pinned you down, grabbed a sharp piece of flint, and literally drilled a hole straight into your skull. There were no painkillers besides a stick to bite on, and the surgical tools were just jagged rocks. It gave you a permanent sunroof in your skull, but it actually worked. So, what's the real takeaway from all of this? Whether you were getting your skull bored out with a jagged rock, having your frostbitten toes chopped off, or eating river clay to flush out your belly, the ultimate, most effective medicine wasn't actually the mud, the fire, or the spider webs. Let's be real, as an individual, prehistoric human, you were basically just a walking snack for a saber-toothed tiger. You had no claws, no fur, and zero survival skills when unconscious. The only reason our ancestors prevailed and didn't become a giant pile of fossilized disappointment is because when someone fell off a cliff or got mauled by a wolf, the rest of the tribe didn't just leave them for the hyenas. They stayed behind. They carried you to safety, they kept the campfire burning, and they fiercely protected you for months while you healed. Ancient life was brutal, gross, and smelled bad, but it proves that empathy isn't a modern invention. It's the exact tool that kept us alive. We didn't survive the Ice Age because we were the strongest. We survived because we looked out for one another. And so it turns out, the best prehistoric medicine was each other.